Hi, my name is Maria Boggio. I'm a physical therapist at Lovelace Westside. Today I will be presenting to you the PowerPoint presentation, Are Falls Preventable? What is a fall? Landing on the ground or something other lower surface when you didn't intend to be there. For example, slips, trips, stumbles, almost falls. Actually, 1 in 4 older adults 65 and older are at risk for falls per year. There are many other factors that play to increasing your fall risk. For example, anatomical and physical changes that occur while we age, cardio and pulmonary changes, functional changes, our changes in our musculoskeletal system, hormonal, and any neurological changes secondary to increase our risk for falls. There can also be chronic conditions that increase our risk for falls. For example, diabetes. While this also changes our system for our blood sugar, it can also create changes to our sensation, where we lose feeling in our lower extremities, changing our balance, and increasing our risk for falls. Other chronic conditions such as neurological conditions like Parkinson's and multiple sclerosis that can change our dynamic mobility and also increase our risk for falls. Our falling may also be increased risk with changes in our medication, our pain if we have lack of sleep, things like our vision changes, reduced activity level, strength or endurance, maybe a new home, visual changes, lighting changes, so extrinsic and intrinsic factors that could increase our risk as well. My first suggestion to reduce risk for falls is to start small. Talk with your doctor, your physical or your occupational therapist to discuss strategies or to identify initial risks and create recommendations or changes that you can modify within your home to reduce your risks. Along with starting small at home and looking for objects or risks for falls, you also want to take a look at what your level of physical activity is like. I like this picture on the slide to the right because it discusses the amount of vigor or the amount of activity that you perform. That with reduced fun function creates more frailty and failure with age. So for example, if you fell and you fractured your hip, the challenge to climb that slope back up in past frailty and create function and fun is harder than if you were to maintain it at your age. This is a great slide because it talks about how to increase your muscle strength efficiently. So suggestion first is to talk with your doctor about either joining the gym, going to physical therapy so that they can further instruct you on how to strengthen efficiently. But for example, on this slide, it coaches you on how to create the right weight and how much to perform to increase your strength. So you want high weight, low repetitions for strengthening, and for endurance, you want low weight, high repetitions in order to increase your strength. To exercise, it is recommended that you exercise 12 to 16 weeks to see noticeable increases in your strength. Again, please talk with your doctor before starting a program. Begin with PT or a fall prevention class. This is a great idea. Physical therapists and occupational therapists can screen you and see how your measurements for balance, sit stand, measure up to the norms of your age and gender. These become great tools to carry over to a home program. Now I'll talk about evidence-based fall prevention programs. The first program that I'll talk about is Otago. This is performed in a physical therapy clinic with a PT or an OT that is trained to deliver as part of your treatment. It includes an exercise program, walking program designed for you, and progressive so that you will continue the program weeks after attending physical therapy. Next is a matter of balance. It's an 8-week, 2-hour session, including peer group discussion, exercises, education, and some behavioral modifications, identifying the fall risks around your home. All the exercises can be done sitting or supportive. Excellent for people who are fearful of falling. Included on this PowerPoint is the webpage for A Matter of Balance. Next, stepping on. This is a great follow-up following Otago program. 7 weekly 2-hour classes, including peer discussions, exercise, and expert lectures. You can feel safe and report reduced fear of falling and walking more independently at home. Next, Tai Chi. This is a great program for continuing balance training and fitness. There are great community events happening in Rio Rancho, Albuquerque, and in Corrales that offer Tai Chi, as well as senior community centers that offer Tai Chi. I think that this is a good balance for both strengthening and stretching the body to enhance the ongoing challenges with our balance that we may have. And as I said before, there are great community resources for Tai Chi. This is a PowerPoint on finding evidence-based fall prevention programs. The pathstohealthnm.org is a great resource because it'll provide you everything that's happening within the community. Other ones listed, Area Agency on Aging. I honestly do not know much about the eldercare.gov. However, the phone number is on there for further information. At Outpatient Lovelace Westside, we do work with our patients, identifying what their fall risks are, providing them a strong program, reassessing them, educating them on fall risk, and encouraging them that a fear is a real thing, but how do we reduce your fear of falling? All right, this is my favorite part of the PowerPoint slide. Now we're going to turn our screening tools into your treatment. So let's get started. Please make sure that you have a chair without armrests by you so that you can perform these next screening tools to check your balance and see how you measure your age and gender. These next 2 slides are pulled from the CDC's website. So if you are having challenges seeing this PowerPoint slide, you can go to the CDC and type in the 30-second chair stand, and same with the next slide. You can type in CDC, the 4-stage balance test. The 30-second chair stand, you will sit in a chair approximately 17 inches in height without armrest. Now, if you need the armrest, that is okay. But what you will do is you will perform a sit-stand as fast and as safe as possible, all the way up and all the way down in 30 seconds. Then, finding your age and your gender, you will see what your risk of falls are. So, if I am 65 years old and a female, if I scored less than 11 repetitions, I am at an increased risk for falls, and it is recommended that I use some form of an assistive device. This is the CDC, the 4-stage balance test. This test will assess your balance going from a static position to a narrow base of support to a single limb support. The test states that if you lose your balance at the 3rd marker in a tandem stance, you are at an increased risk for falls. Setup for this test you will do in standing, and you will start with your feet as close together as possible, holding it for 10 seconds. If you can tolerate and you don't lose your balance, you can progress to the next marker, and so forth. Again, I like this exercise because you can perform this at home for balance strengthening. The safest spot to perform this would be in the corner of a room, someplace that if you were to lose your balance, you would be next to a wall to help support yourself. This test is called the Chair Sit and Reach test. This will identify what lower extremity flexibility is like for each individual. The instructions state that you will sit as close to a chair edge as possible, leaning forward to try and touch your toes. Now, I do want to be a little bit specific when I say when you lean forward to touch your toes, you need to hinge and fall forward from your hips. Don't curl forward in order to touch your toes. If you can tolerate touching your toes, then you have sufficient flexibility. But if you're lacking, this will be a great exercise that you can continue to work on. The last test is called the single limb stance. This assessment will identify what strength you have in a single limb lower extremity. So I know this comes up earlier in the 4-stage balance test, but this is a little bit more specific to your age. I like the single limb stance test because it separates your age, and it also gives me an idea what your ankle strength is, what your lower leg strength is, what your hip and glute strength is. So again, these are some of the assessments that the physical therapist will look at in organizing and creating a exercise program for your home program. So in summary, the slippery slope of aging, I think that's such a great slide because it demonstrates to you how hard it is to climb back up into higher functional mobility when injury does occur. So you want to prevent those falls to reduce any risk of falling down that slippery slope. Anatomical changes, it's all going to happen to us. And at this point, I think the most important thing is to have as much education as possible, preventative health and fitness, make those plans so you can maintain your health. And last, the list of physical therapy assessments. Again, these are great tools so that you can check your own balance, but then also in turn make those exercises for you and try and reach those goals to match your age and gender. Thank you so much for letting me take the time to provide audio to this PowerPoint. I am sad that I will not get to see many of you because of COVID, but would love to work with you in the future. Again, my name is Maria Boggio, physical therapist at Lovelace Westside. And if you do need any of our services, please just call our local number at 505-727-2123. Thank you.